I've got to say it. The GLP-1 medications are probably the most effective tools we've ever had for obesity and metabolic health. And yet sometimes the media talks about them as if they're radioactive. So today I want to talk about the real science, both risks and benefits, and why I personally think these meds are amazing when utilized the right way. All right, Landon, hit the disclaimer. So what do they actually do? They mimic a hormone your gut already makes, GLP-1. This tells your brain, hey, we're full. It also slows down gastric emptying, which means your stomach just drains slower. It helps your pancreas release insulin at the right time and makes that insulin more sensitive. And so this combination of everything, your appetite goes down, your blood sugar is more stable, and the scale usually follows. In the step 1 trial, semaglutide users lost around 15% of their body weight in 68 weeks. The SURMOUNT-1 trial with tirzepatide, they got closer to 20%. That's basically the kind of weight loss that used to require surgery. I was sent a video over a news segment that said the GLP-1 medications were melting eyeballs. So let's talk about the eye issues that have been identified with it. There are a couple studies, the JAMA Ophthalmology, the 2024 and 2025, that found a possible link between semaglutide and something called non-arteritic anterior ischemic optic neuropathy, or NAIO, which is a fancy word of saying sudden vision loss due to lack of blood flow to the optic nerve. Is this scary? Yeah, it sounds like it, but here's the deal. Those were observational studies and not randomized trials, meaning we don't know if the drug caused it or if the people taking it already had other risk factors like diabetes, hypertension, or sleep apnea. And the absolute risk is still tiny. In the general population over 50, NAION happens in only about 2 to 10 people per 100,000 per year. So even if there's a small uptick, it's still going to be very rare. I've never seen it in my population, and none of the other clinic owners I've ever talked with have ever seen it either. And there's also an older SUSTAIN 6 trial where people with existing diabetic eye disease had a higher rate of retinopathy early on when using the GLP-1 medications, but that was from rapidly improving blood sugar, not the medication being directly toxic to the eyes. So the takeaway from that is if you already have diabetic eye disease, get checked and improve your glucose gradually. If you ever wake up with sudden painless vision loss on or off these meds, don't call your friend, don't Google it, just call the eye doctor immediately. Another thing that I get a lot of questions over is thyroid cancer. There is a black box warning on the GLP-1 medications and thyroid cancer. So where did that come from? It came from rat studies. Rats get C-cell tumors at doses that we don't use in humans. Rats also have a GLP-1 receptor on their thyroid, which humans and primates don't. Or if you do, you have very few of them. There have been large human trials like the BMJ Scandinavian cohort from 2024, and they have found no increase in thyroid cancer with GLP-1 use for about up to 4 years. We still avoid them in anyone with multiple endocrine neoplasia type 2 or a personal or family history of medullary thyroid carcinoma. But for everyone else, there's just no credible signal right now. Pancreatitis is another concern that people bring up. And as for pancreatitis, the big SELECT trial actually showed that only 0.2% of semaglutide users had it, compared to 0.03% of the placebo group. So it's not only higher, it may even be less. The main thing that does go up slightly is gallbladder issues if you lose weight too fast. So make sure you hydrate, eat some fiber, and don't try to outrun the scale. So now let's talk about the good stuff, the benefits. This is where things are much more fun and happy to talk about because these drugs are doing more than just shrinking your pant size. Fatty liver. So MASH and NASH, we've made a video over about this in the past. In the New England Journal of Medicine 2021 semaglutide trial, 59% of patients had complete resolution of mass versus 17% on placebo. Then in the 2024 Synergy-NASH trial, with tirzepatide showed 62% resolution. And in 2025, semaglutide's phase 3 trial confirmed the same trend. The liver fat is melting away right along with body fat. So it's not just cosmetic, it's fixing an organ that was inflamed and overloaded as well. Heart protection. The SELECT trial in 2023 looked at adults with obesity but no diabetes, and they found a 20% reduction in major cardiovascular events like heart attack and stroke. That's enormous. For comparison, statins, often mentioned the gold standard for cardiac prevention, often reduce events by about 25%. So GLP-1s are getting close to that territory while also fixing weight, insulin resistance, blood pressure, and just overall improving well-being along the way. They do have some kidney protection as well. The FLOW trial in 2024 showed semaglutide reduced kidney failure and cardiovascular death in people with diabetes and chronic kidney disease. That's the first GLP-1 with a proven kidney benefit. So we're talking about protecting organs head to toe with these. They have inflammation and further metabolic healing. Across the STEP trials, patients' high sensitivity CRP levels, that's a non-specific inflammation marker, dropped by 30 to 40%. So you're calming the fire that drives heart disease, joint pain, and aging itself. We've had a lot of people anecdotally with like rheumatoid arthritis and other chronic inflammatory diseases report that they're needing less of their maintenance meds or needing decreased meds for their breakthroughs as their breakthroughs are being less and less severe. So we have a few who have met their weight loss goals, but still stay on little tiny doses of these to help prevent that as well. There are brain health and Alzheimer's studies to show that it seems to be reducing this. So it seems that GLP-1s are even helping brain health. Observational data shows lower dementia rates among GLP-1 users. And in a phase 2 trial with liraglutide, MRI scans actually showed slower brain shrinkage in people with early Alzheimer's. Ongoing EVOKE and EVOKE Plus trials with semaglutide will tell us more. So we'll wait for that. But overall, it seems to be exciting and positive. So yeah, from liver to heart to kidneys to brain to inflammation, this class of meds is rewriting how we think about metabolic disease. And how does this compare to bariatric surgery? In terms of weight loss specifically, bariatric surgery remains supreme. It's about 20 to 25% body weight loss long term, but the latest GLP-1s, dual agonists, triple agonists are catching up with 15 to 20% weight loss without a scalpel. Surgery will always have a role, but GLP-1s make metabolic health way more accessible for the average patient. Anecdotally, combining GLP-1 with sleeve patients or other bariatric surgery patients have shown us amazing results for our patient population. So let's now talk about the part that most people are worried about as well, keeping muscle. Weight loss doesn't automatically mean health benefits. If you're not resistance training or eating enough protein, you're not just losing fat, you're losing muscle and you alongside it. Studies using DEXA scans show semaglutide mostly reduces fat mass, but a bit of lean mass will still go with it if you don't train. That is why we hammer this point. You need to have at minimum 2 days of resistance training, ideally 3 to 4 times a week. We also want you to try and eat around a gram of protein per pound of body weight. We want you to sleep 7 to 9 hours a night. We want you to move daily. Even if just walking gets you out and moving, let's get 20 to 30 minutes of walking in a day. And truthfully, I take tirzepatide myself. I wish I could tell you that I have the food discipline without it, but allows me to stay in control while having a hectic life with young kids and a business and trying to do everything. I developed this bad habit of stress eating after long emergency department shifts. We're busy, it's stressful. You don't really get to sit and eat much. So if you do eat, it's just eating real fast on the go. And I get home and my stress management was basically just to eat until I fell asleep. And that was about the most comfort I could get. So once these came out, I started them and it allowed me to just put a backstop on. I could feel myself kind of slipping and just going down that path of just eating for comfort, but at least have a backstop to where I'd get to a point where I just physically couldn't eat anymore. Also, I've gained muscle while on these. I do lift at least 3 days a week. I run on my off days. I get my protein in. I try and sleep. I am on testosterone therapy as well, but they have been an amazing tool in my health journey. GLP-1s aren't magic, but they are a multi-tool. They lower weight, improve blood sugar, protect the heart, kidneys, liver, and maybe even the brain. Scary side effects are rare, but the benefits are life-changing for the right person. So don't let the media make you fear a molecule your body already makes or tell you that you're cheating for using the tools available to you. Just use it wisely, use training, protein, good sleep, and do all this together to build a stronger, healthier version of yourself. And if you have any questions over these, of course, reach out. We're happy to be a resource for you. Text or call us, and we can help you utilize these the best way for you.